We're going to make a complete evaluation that's relative to clinicians in both the inpatient and outpatient setting. This would work well for psychologists and psychiatrists. We're going to do an initial assessment. I've already opened up my note on our patient, Tabitha Stevens, who's 17 years old. So I'm just going to go into the work area of this unfinished note. All right, we're going to start over here in the history of present illness. And I'm going to cheat a little bit and use a custom button. It says Tabitha is a 17-year-old girl. This evaluation was requested because, and I already have a little line ready to go for conduct disorder. I'm going to come over here to the symptoms area and come right into conduct disorder. And I'm going to say that the information today was received from Tabitha, from her family, and maybe from another professional source, teachers. And conduct disorder symptoms that are present. Let's look at aggression first. Let's come over here and say that she bullies, she's cruel to other people, she intimidates other people, and she threatens. In terms of destruction, she has participated in destruction of property. Deception or theft, I'm going to say she has been caught lying or conning. Violation of rules, she's run away, she's been truant, and she's had night absences. Let's make the severity of her illness high. We can go back. If she had chemical dependency issue or anxiety issues or other issues, we could go into those areas too. I'm going to come over here and say that right now she denies having an eating disorder and she denies any mania. Let's go over here to the past psychiatric history. As you may know, when you do a complete evaluation in ICANotes, if this is the follow-up evaluation after another doctor, nurse, or therapist has done a complete evaluation, information that was already put into the history areas, past psychiatric history, medical, social, developmental, family history, will push forward for you. If there's nothing new to add under the past psychiatric history, you can just read through it and confirm it with the patient. If you want to add some additional information, let's say, for instance, we could come over here and use this addendum button to do that. I'm going to come over here and talk about acting out behaviors and say that she admits to acting out. In addition to admitting to acting out, she talks about her sexual promiscuity and truancy and night absences. Let's go over to the medical history. Once again, if there's nothing to add, you don't have to put anything in. I am going to put in an addendum, however, and talk about adverse drug reactions and say that she does not have any, and that for allergies, she does have food allergies. She's allergic to peanuts. That causes hives. Okay. Under reproductive history, I might want to put down whether she's pregnant or not. I'm just going to say she's not pregnant. If she was pregnant, you could detail that up to and including her due date. We can look at tobacco history. I'm going to say that she is a current everyday smoker. Maybe she started about 2 years ago, and she smokes greater than 2 packs a day. This information is put right into your tobacco history report here. Let's look over at the developmental history first. Under developmental history, we're going to come down here and look at pregnancy complications. I'm going to say that mom used alcohol during the pregnancy. The duration of the pregnancy was short. It was only 28 weeks. And her postpartum period, this child had breathing problems, an incubator was used, and she was put on a ventilator. Her birth weight was low. It was 3 pounds, 5 ounces. Now we can come down here and talk about her developmental assessment. If it was normal, you could click here. Tabitha passed various developmental milestones at age-appropriate times. Or you could come down here in detail and say she was delayed in how long, when she walked or started using single words or phrases or sentences, or with toilet training. I am going to go back now to social history and just capture a little bit of childhood history in this area here specific for children. And I can say that she was raised by, for example, an intact mom and dad, and Her birth order, she was the middle child of four. And let's talk about family stressors. Maybe there's been financial and legal problems and frequent moves. The current stress level in the family is high. Are there indicators of emotional problems, anger management problems, defiant behavior, aggressive behavior, and violation of rules? Primary relationships. How does she get along with mom? Satisfactory. How does she get along with dad? Negative. How does she get along with her brother? She gets along with brother well. We can also go in and look at her school functioning. What grade is she in? I'm going to say she's in the 11th grade. Um, what positive behaviors does she have in school? I'm going to say that she does like to participate in sports. Does she have disciplinary problems? I'm going to say yes, numerous, including suspensions and aggressive behavior, oppositional and defiant behaviors. What does she say about school satisfaction? She says she's not happy at school. How is her social functioning with adults? I'm going to say poor. She says it's parents report she's disrespectful, disobedient, and oppositional and defiant. How does she function with peers at school? I'm going to say she also has poor peer functioning. She bullies other people and she teases other people. She's also aggressive. She's been truant from school. School refusal is a problem. There's other information here in terms of talking about school to contact person, release of information, and whether she's literate or not. Let's come over here to family mental health history. And it says that she has, her sister was treated for bipolar disorder. Otherwise, the family history is negative. We'll finish this note up by doing an initial assessment. And I'm going to say that she is guarded, minimally communicative, disheveled, and unhappy. Her speech and language are both normal. Her mood seems to be depressed, severe, downcast, psychomotor retardation, and body posture. Ideas but no intention of committing suicide. Her affect is not normal. I'm going to say that she has inappropriate anger. Her associations are normal. She is not psychotic. She says she's not homicidal. Cognition seems to be normal. IQ seems to be of normal intelligence. Insight into illness and social judgment are both poor. There's no signs of anxiety. She seems to have a normal attention span, but her behavior is oppositional, defiant, and uncooperative. She doesn't seem to be withdrawing from drugs or alcohol. To finish up this initial assessment, we're going to come over here and expand this area here. And first of all, we're going to say that you can say that she's being treated in either an inpatient or an outpatient facility. I'm going to go with psychiatric hospital right now and just put down that she's, we're going doing crisis focused intervention with her. And we want her to participate in as many activities as she's able to. And then I have a custom button that I've made for treatment planning specific for young people with a conduct disorder. I was able to put that in using one of our custom buttons here, which is very nice. When you hover over any of our custom buttons, you can actually read what it's going to say. Risks and benefits of therapy were explained to parents, etc., etc. Okay, let's go back. Okay. We'll skip the start and end time medical history shows here. We have her notes and risk factors. We do have a suicide and violence risk assessment. She's a strong candidate for this. I'm going to come over here and say history of risk factors, history of violence or aggressive behavior, which has caused injury. She's had a suicidal family member that attempted suicide. She's had some self-injurious behaviors, including cutting and burning herself. What are her current risk factors? She's agitated and angry, depressed mood, perhaps insomnia, and suicidal ideas. Suicidal ideas, but without any intent right now. Ideas are periodic. Let's look at her protective factors. I'm going to say her family support and her her therapeutic relationship with your team. Risk of suicide is probably Low right now, the risk of violence is, I'm going to put down high. Okay. We've already put in our ICD-10 diagnosis, conduct disorder, adolescent onset type. I can go ahead and code this note for evaluation and management. I get a 99202, and I'm going to go ahead and compile this note. This is a complete evaluation. Once again, I'm going to say it's in the inpatient facility, or I could say outpatient. It doesn't matter, either one. And I could say it was done by the psychiatrist or the psychologist. Click continue. All I need to do now is electronically sign this. Return to our chart face. And here's our complete evaluation. We're finished.